I screwed all that up. That's okay.
And then, how do I do the presentation?
Maximize. There you go. And you got to share your screen, and then here, and then hit that record button. And then how do you want them to view?
It looks like Michael is sharing. Is he sharing his screen? Okay.
No, you're good. And
Can everyone see the presentation?
Yes.
Okay.
Yes.
Okay, let's, is it weird or is it like full screened?
Full screen.
Oh, it's full. Is it ready to go? Is that better?
Even better.
Awesome,
And
cool.
did you hit record?
Yes.
No, that's sharing.
Oh.
What about recording?
It says recording on the top left.
Yeah, it does.
Okay.
Mine too.
Yeah.
Okay. Okay. Awesome. I'm gonna get the
Awesome.
background so Eugene.
Yes.
Okay. Whoops, sorry.
Morning, everyone. My name is Eugene, and so today we're going to be going over the Introduction to Evaluation webinar series, and this is part 1 called Tool Design. So just introductions. My name is Eugene Kwan. I'm an MPH. I got my MPH from UC Davis, and I'm a program evaluator for the ACORNS CITE grants as well as Comprehensive Cancer Control Program grants. If everyone wants to introduce themselves briefly, there's not too many people, so.
All right. Chris Hamlin, Riverside, San Bernardino County, Indian Health. I'm one of the health fitness specialists.
Nice.
Welcome.
Lisa Graham, Tully River Indian Health Center. I work in the behavioral health department as substance use counselor.
Great.
My name's Linda Lawson. I work at the Manchester Pointerina Bandapomo Indian Tribal Office.
Awesome. Michael?
Hi, everyone. My name is Michael Mudgett. I'm an epidemiologist here at the California Tribal Epidemiology Center, housed within the California Rural Indian Health Board. I will be doing a webinar next week as a follow-up to this webinar, part 2.
Awesome.
Awesome. So an overview of this webinar series. We're going to have 4 webinar series over 4 weeks. Today's introduction / tool design. And then Michael will be presenting on August 9th and August 16th. And then I'll be presenting the last one on August 23rd.
You got 9 on there.
Yeah, those dates are wrong. Yep. We missed that. So just diving right in, what is evaluation? So evaluation is a systematic method for collecting, analyzing, and using data to examine the effectiveness and efficiency of programs. And so when we're talking about evaluation, we also want to know initially what a program is. And so a program is, any set of related activities undertaken to achieve an intended outcome. And in our case, it's through an organized public health action. And so the ACORNS CITE grants are essentially in the broad scale, they're programs. So we just went over this definition. This is by the CDC. And essentially evaluation is kind of seeing what a program does and then making it better. And so the history of evaluation is that it started around in the 1960s during the Kennedy and Johnson administration, when there are a lot of social programs that are being enacted, but there was no really follow-up on how these programs were doing, if they were being effective, as well as like cost-benefit analysis. And so evaluation kind of stemmed from that, and then understanding how these social programs are working and how to make them better. And then so why do we use evaluation? So when we have researchers, it's really important to conduct research and to move to gain information and move forward upon that. But evaluation really helps us kind of step back and see what we could be doing better. So efficiency and effectiveness are 2 big things that evaluation pushes. And so 2 things. One would be improving program design and implementation. So when you're evaluating, you're periodically assessing your activities and ensuring that they're being as effective as possible. Additionally, evaluation can help you identify areas for improvement. So when you maybe finish a program and you have your final evaluation, you can see what was done well, what didn't work out, and then from there, if it's a multi-year grant especially, you can implement those new improvements into your next year. And lastly, evaluation helps with the end results and sharing those results. So not only ensuring that when you do your evaluation, you can share that information with your stakeholders. The second part would be to demonstrate the program's impact. And so a way you would do that is by sharing what information you have, what data you've collected from your program, and then being able to say, hey, this is all the progress we made, this is all the success that we have. And so ensuring that maybe there be future funding or, you know, engaging stakeholders and participants and showing the great work that they were doing. So this little chart shows kind of a circle, which is how evaluation really works, engaging stakeholders and describing the program, and then evaluating the design and working through those, and then coming back to the stakeholders. Ultimately, it always works in a circle and it always comes back to the stakeholders and engaging them. So what are some types of evaluation? So initially, in the bottom, you can see formative and summative, and that's the state, like throughout the stage of a program. So initially, in the formative parts of a program, you need to conduct a needs assessment. So understanding what the community needs and what the program can be doing, what it should be doing. Next, there's formative evaluation, ensuring that the program or program activity is actually possible and feasible, that you know, you can actually start a program and have it be, you know, plausible. And then next would be process evaluation. And this determines whether the program activities have been implemented as intended. So this kind of goes from formative to summative when you're enacting the program. And so are you hitting your milestones throughout your program and your desired outcomes? This is exactly what process evaluation is. And the next part would be summative. So this is kind of towards the tail end of your program. You have outcome evaluation, which measures the program's effects in the target population by ultimately seeing outcomes of the objectives that you had planned for the program. And then the next would be impact evaluation, which assesses the program's effectiveness in achieving its overall goals. And so this is just kind of another picture. The top part shows the program stage, I guess the stages of the program, and then below are the evaluation types and questions asked throughout the different stages of the program. So how do you start evaluating your programs? So evaluation, while very formally you can do an evaluation plan, report, and do all these things, naturally, just as humans, we are always evaluating. Every decision we make is based upon something that's happened to us before. And so when we have, our subcontractors, whatever they may be doing, they're constantly just internally evaluating their programs and making changes. So good job to everyone, naturally doing that. Another great thing is that we're working with a specific population. And so when you have leaders at tribes and tribal organizations that have cultural sensitivity, knowledge, and social understanding, those are definitely things that play a big part in how you evaluate your program and setting realistic, expectations for the process of your program. So what are the steps in evaluating a program? The first thing you can do is define your stakeholders. So a stakeholder is essentially anyone that is involved with the program. That could be supporters, implementers, recipients, decision makers. Literally everyone who is involved with the program is a stakeholder. Getting them involved early is a very important part of kind of having everyone on the same page, as well as establishing common expectations for the program. This helps clarify goals and objectives of the program, and then you'll be able to evaluate them easily as the program progresses. Next, you will want to describe the program. So taking the time to articulate what your program does and what you hope to ultimately accomplish through the program. So for the ACORNS grant, ACORNS CITE, we're working on chronic disease, working through PSCs to implement strategic changes within tribes and tribal communities. Next would be the focusing the design of your evaluation. This is actually a big part because it kind of really, this is like what the evaluation portion is. The different types of evaluation all fall kind of within focusing design of your evaluation. So whether that was process or outcome, throughout the entire stages of the program, you have to kind of develop how you're going to evaluate your program. And the next step would be gathering evidence. So this is more or less the data collection component of evaluating a program. Whether it's qualitative or quantitative data, this is a part where you're collecting data and then turning it into information where you could then draw conclusions from. So this is the analysis that you'd be doing later on, and then from there, sending out your information and presenting your findings. So going back to number 3, focusing the design of your evaluation. Under the part of this stage, you would perform a community needs assessment. So going back and saying, what does your community need and what are the things that will benefit them? I don't know if everyone is familiar with logic models. Hopefully you are. They're super fun, and this is what they kind of look like. And the logic model is in part of every evaluation plan, and from there you can kind of see the flow from left to right of how the evaluation occurs and the inputs, outputs, and outcomes of the program. Now going back, we have developing measurable objectives for your outcomes. So when you do have a program, you want to make sure that your outcomes are measurable. There's something that you can actually track the changes of. That doesn't necessarily has to be hard data like quantitative information, but even just receiving like feedback from individuals who were recipients of the program would be a measurable outcome of the project. And the next would be writing the evaluation plan. So for ACORNS CITE grant, especially over the 5-year plan, we have to write, how we're going to be evaluating the program. And this can be done from a very small scale to maybe just a simple program you're enacting in your community to a national level for, national policies. And so evaluation plans are very important in that respect because everything can be made better, and efficiency and effectiveness are always things that you should be considering. So next, when and what should you be evaluating? So evaluation essentially should be happening all the time. It's kind of around the clock. It never really starts and stops because when you start your program, it begins right away at the same time as when you're developing maybe even your work plan, what the program is. And at the end, you still have work to do because you're going from, we've collected all this information at the end, and now we need to distribute it back to all the stakeholders. And that goes back to the circular image I had before about just engaging your stakeholders and always evaluating. What should you be evaluating? Collecting any relevant data that you possibly can. So in a broader sense, evaluation tries to collect information on the outcomes, and you have listed that in your logic model. But any other relevant information that you can will always help to kind of show the progress and success of your programs. So what are some important things to consider? So evaluation should always be on the back of your mind. And first, good evaluation is tailored to your program. An evaluation plan made for a national policy is not going to be the same as an evaluation plan made for 500 people in a small community. They have different expectations, different processes. So when you're evaluating, you want to make sure that's tailored to your program and to fit your needs. Next, good evaluation is inclusive. And so this ensures that it has diverse viewpoints and that everyone's kind of opinions is being taken into consideration. And you want to be as unbiased as possible. So having maybe just, if you have a sample size of 80, which is fairly small, you want to make sure that it's completely random, not just pulling just from the people that would have a positive reaction. You want to make sure that your evaluation is unbiased and is inclusive to all individuals. And that kind of goes hand in hand with good evaluation is honest. Evaluation results strengthen your program, and whether it it can strengthen and show the limitations of your program, but you can't do that if it's not real, unbiased, honest information. You want to make sure that your data is as truthful as possible, because then it can actually give you a good standing point and then see how you can make your program ultimately better. And good evaluation is replicable. So, for example, there is turnover within organizations all the time. And so having one person create an evaluation plan, and then if another individual came in at a later stage, they'd still be able to carry out that evaluation plan and being able to do it regardless of who started it. And that is something that could also be replicable the next years. And lastly, evaluation should always be on the back of your mind. And it naturally is. You're always just kind of naturally seeing what you can do to make things better. Program evaluation is just a very formal way of us creating a plan to do that. So now we're going to go into kind of types of data and data collection. So there are two types of data that we're going to be focusing on, this qualitative and quantitative data. So qualitative information is interviews, surveys, questions, discussions, meetings. It kind of relates to like the five senses. Quantitative data is measurements and numbers, so things that are kind of concrete. So an example for each would be a quantitative piece of data would be kind of maybe like blood pressure amongst a group of people. Those are hard numbers that are entered in the system. And you can find like the average, you can find the most common blood pressure, you can find the range, versus qualitative information might be a survey that you administered to those recipients and say, how was your experience at the clinic today? No one's answers are going to be exactly the same. Can be, but it's kind of rare. And so those are more so responses and kind of gaining a better understanding. So now you know the two types of data. You want to know what kind of data do you want when you are evaluating a certain process or program. So quantitative data is typically used to determine outcomes of a program, data that provides a representation of the sampled population. And like I said, it's hard numbers. And then next, qualitative data can be used to gain a deeper understanding of the situation program. So receiving feedback through things like surveys can allow whoever's collecting this data to understand how these people really feel. And this information can also be later coded into quantitative data. But ultimately, you need to have both. Both are very important in data collection and can be used in tandem to really have a good understanding, grasp of how the program is doing and what can guide future decisions. So basics tools for data collection. So these images are interviews, surveys, observations, focus groups, and case studies. These are all things that can be done to collect data. For the ACORNS CITE project, it's probably most useful to use surveys, questionnaires, and then from there, possibly observations and then interviews. Surveys are just a really good way to receive both quantitative and qualitative data, and for the most part, they're pretty easy to make. So when you're creating a survey or questionnaire, it's kind of hard to know where to begin. And it kind of flips back and forth of a good place to start is developing a list of answers of what you were looking for. So kind of working backwards, seeing what types of questions will you be asking to get these answers. So when I conduct a program and I want to also have a survey to go with that, I kind of want to know, I want to put out questions that will answer questions that I want to know the answers to. Sorry, that was kind of a complicated statement. So essentially, you want to start with a list of answers of what you want, and then from there work backwards to develop those questions. So there are two main factors to consider when writing a survey. The first would be the types of questions, and the second would be the length of the survey. So first, the types of questions. There are two types. There's categorical questions and ordinal questions. So in categories, you could have yes, no, multiple choice, check boxes, and these are different types of questions you could ask. And then ordinal questions would be kind of drop down or ranking questions. So ranking questions from 1 to 3, which one do you like the most? And all these questions are great, but can also give you a lot of different information. And so picking the right type of question to ask can give you a certain type of data. So taking into the consideration the audience you are asking these questions to are also really important. And so whether it's a language barrier or if it's just a level of sophistication like readability, you want to make sure that whoever you're giving the survey to will be able to understand the questions and will be able to answer the questions. Next would be survey length. So this is just a little picture I drew up about long surveys. No one likes doing long surveys. Personally, like, I don't know, surveys come out whenever, you know, if you're on like a call paying your phone bill and they're like, hey, do you want to take this survey at the end? Most of the time you probably say no. Or if you buy something online, they want you to take a little survey afterwards. That's them collecting this information. And the big thing is the length of the survey is a very strong indicator of if the survey is going to be taken. And so survey lengths should be limited to 10 minutes maximum. This is not a hard rule, but if you're just giving it to people after a program or an event, it's something that you want to kind of see. Like you want to stay under the 10-minute mark. The more questions you ask, the respondents will spend less time answering each question, and as well, survey completion rates decrease. So it's really important to kind of keep your surveys as concise and just really asking the most important questions as possible. So here are some graphs showing response times correlating to question counts. So you would think it'd be linear, but as you can see, the more questions you ask, the less time people spend on the surveys, regardless of how much each question would take. So if you can see on the bottom left graph, question count from 1 to 5, average seconds spent on per question is 45. But then when you have a question count up to 20, it reduces in over half. So people spend a lot less time answering those questions. So in addition to surveys being limited to around 10 minutes, you would also want to limit them to around 20 questions or less. So this really goes back to the fact of having very concise surveys and then asking the really important questions. And this also requires balancing the question types, just because when we're going over different questions earlier, different types of questions take different amount of time. So yes, no questions may be a little easier to answer versus a ranking question or providing feedback in the form of like an open response. These will all take different amounts of times, and so those are things to also consider when composing your survey. So what if you do want to write a longer survey? Incentives are a huge thing. So for example, I am part of the California Tribal Epidemiology Center, and we're conducting our own BRFIS, which is a behavioral risk factor surveillance system. And so this is a very long survey. It could take, sometimes an hour or more. And so in order to do that, we provide incentives to the recipients, whether it's a gift card or whatever. Incentives are a good way for people to kind of stay longer. It's making it worth their time. Without incentives, it's kind of hard to have longer surveys or to actually really get people to focus and put the time in. So tips when writing your survey. You want to write questions that are simple and to the point. And this can be done through yes, no questions or multiple choice. Those are probably the best ways to do that. Use words with clear meanings. So you want to keep your sentences as short as possible, meaning you don't want long run-on sentences that can be confusing. And you also want to make sure that it's as simple as it can be, not using maybe jargon that's too sophisticated, or if people may not know the terms. That's something that you would want to stay away from. Limiting the number of ranking options. So going to ranking questions, they can take a little bit more time, but limiting the number of how many choices you have in that can also help reduce the time that the survey will take. In multiple choice questions, covering all options without overlapping. So making sure that all the if you have a 4-part multiple choice question, that each part of the question does not overlap or does not have any kind of gray area with any of the other answers. Avoiding double-barreled questions. So double-barreled question is asking kind of 2 questions in one. And so it can be confusing for recipients to answer those questions because they don't know if they're answering the first or second part. And ultimately, when you receive that information and that data, you can't really say which question they're answering. And so that can be confounding in your own data collection. Continuing an offer out for questions that don't apply. So maybe putting as one of your options, not any. That is also really important just because sometimes people will rather answer a question even if it doesn't apply to them rather than saying that and then skipping the question. So giving them an offer out is important. So whenever people do not, if they did not, let's say, participate in that portion of the program, then it's important for them to have the option to say that they did not participate. Making recall easy. So this also goes kind of hand in hand with when you administer your survey. You want to make sure that you want to do it as soon as possible after the program or after the activity. Something where people don't really have to recall far back to give quality answers. And then considering the flow of the survey. So when you're reading through the survey, is it making chronological sense? You kind of have an introduction, baseline, and then as you go on, you're making the survey more specific, maybe asking questions that, correlated time-wise to how the event was run. And then lastly, developing balanced listings or answers. So making sure that all your questions, there's not an offset with just a lot of specific questions or a lot of generic questions. You kind of have a balanced group of initially kind of broader answers, and then maybe towards the end getting into more specific information. All right, so now that you have this information, just the baseline of evaluation and surveys, I highly encourage you to make your own surveys, and from there you can start the next few weeks seeing what Michael does, start analyzing that information. Does anyone have any questions?
Will you be emailing this presentation out to everybody?
I totally can, yes. I'll change the dates too before I do that.
What if you're out on one of those dates? I will be out of the office on the 9th. Will I still be able to receive the information from the webinar?
Yes, so actually all those dates that I put, they were 9-2. It's actually all of them are in August. So every Thursday in August is when we're doing it.
Yeah, next Thursday I'll be out.
Okay, yeah, so all of these webinars will be recorded as well, so you can watch them at a later date.
Thank you.
Does anyone have any questions?
I'm gonna ask a question only because I'm new to these grants.
Mm-hmm.
So you're giving these webinars, so I understand correctly. So when we go to apply for the next one, this is information that we're going to need in our application, correct?
Yes.
All right.
I can speak
Okay.
to that a little bit. So, hi Lisa, this is Geneva.
Hello.
So as part of your application, you are required to put out the work plan, and then there's another attachment called attachment B, and you talk about your outcomes and evaluation. So in that application attachment, you have to identify a couple evaluation questions, identify what are some of those indicators that are going to answer those questions, and then also like what are your data sources going to be. So this would be good for when you're talking to the staff that are going to be on the project, the leadership at your organization for your application, to kind of like in this planning stage to say, hey, what do we want to know about this program's effectiveness? Like, what do we want to evaluate? And then collaboratively kind of coming up with some questions and maybe how you'd answer those questions and build it into your application.
Okay. Thank you.
Mm-hmm.
And so also in the next few weeks, you will have your final reporting. And so from there, we do have that same worksheet of outcomes and evaluation. And so from there, if you do have any questions, please be free to email me asking me about that. And then I can help you fill out those forms as well. Any more questions?
I'm just going to say, so Chris and I see you're from Riverside, San Bernardino, and Daniel, are you also from Riverside?
Yeah, he's also from Riverside.
Okay, cool. Yeah. I've seen a couple of emails from you guys, so you're back in the office, it looks like. So if you have any questions about the application or any of that, or brainstorming project ideas,
Okay.
give us a call.
Awesome. Will do.
Mm-hmm.
So hello everyone, my name is Julie Villa. If you have any technical assistant needs, attached to your email there was the technical assistance form. You'll be filling that out and sending that back to me. I just want to let you guys know that tomorrow the RFPs will be sent out to you guys. So please read those over if you have any questions. Our next webinar for our technical assistants will be on the 8th. So I'd like to see all of you guys on the line. Come with questions. It's probably going to be our whole team will be on for that first webinar. So evaluation questions, think of those. Eugene will be on the line. And any other RFP questions, Geneva will also be on the line. We also, I don't know if Monica got to introduce herself. Miss Monica Martin is our CITE, our California Indian Tobacco Education coordinator. So she will be on if you have any of the CITE, we're all squeezing it, if you have any of the CITE questions. So just come with your questions. So on the 8th will be our first webinar for that one. If you guys don't have any more questions, we do have a poll, and I know who's on here. We have a couple poll questions. So if you have no more questions, I'm going to go ahead and launch the poll.
And just like a side note for those Q&A webinars, so they're pretty unstructured. They will be pretty unstructured, so it's kind of an opportunity just for you to talk with your team and brainstorm and ask questions instead of say like, is this going to work? Is that going to work? And then we can also just go over like application documents if there are no like specific questions, but just so you have an idea.
I will be out on the 8th as well.
So, yeah. So you we'll have them every week. Oh, you're coming for a site visit, I think, right?
Yes, for one of the other
behavioral health.
No. Native Connections. Yeah, behavioral health.
Yeah.
My bad.
That's okay.
RFB. What does that stand for?
So RFP stands for request for proposal. So essentially that's just going to be tomorrow we'll send an email out, and it's also going to be uploaded onto our website. And it's essentially just like the application instructions. So what are all the project requirements? And there'll also be all of the application documents. So there are 3 things: the application, the work plan, and the outcomes and evaluation. And then there's also going to be some videos, like I recorded some videos that go over the RFP and what are some of those requirements, as well as going through each of those documents that kind of go step by step through them and explain like what we're looking for those. So I think for you guys at Riverside, just if you want, none of those things really go heavily into like policy, systems, and environment stuff, a little bit, but not tons. So if you want more resources or you have more questions about that kind of angle of it, we have some stuff to share, or we can just set up a call and like talk about whatever you have questions about. So.
Okay. Or try to make a trip up there or something.
Yeah. And Lisa, if you want to pop over and meet face to face when you're in town, feel free to come over and say what's up. We live right across the hall/cubicle hall from the Native Connections folks. So.
Yeah. All right, great. And
Okay.
just so you know, my evaluation questions are gonna be simple, since I'm asking, what's this? What's that?
Yeah. You can start simple, and then you can, move on from there. So.
Yeah.
Cool. Thank you so much, Eugene. That was awesome.
All right. Thank you, everyone. We're going to launch the poll. Please make sure you stay on to answer those questions.
It's evaluation. We're evaluating this webinar.
Did you not put them in here?
Well, maybe I'll have to send them out.
Okay. Here, I'll let you announce that. Hold on.
Well, guys, I do not have evaluation poll questions right here, so I am going to be emailing those out to you guys. I do have your email, so by the end of day. All right, guys, have a wonderful day. Stay hydrated.
You guys have a good one.
Thank you.
Bye, thank you.
Thank you.
Okay.